Hi, this is Dr. Donald Pelto. I want to do a little video here about how diabetes affects your feet. What I put here really is the most important thing if you have diabetes and you want to take care of your feet well. It's using a mirror to look at the bottom of your feet. If you're in this new technology age, you can even use an iPad or an iPhone to see how it is in the bottom by taking a little picture. But let's go and talk a little bit more here. So diabetes initially can affect your blood flow. You need to check your dorsalis pedis and posterior tibial pulses. The dorsalis pedis is right here on the top of the foot, and the posterior tib is right here on the back. Those can be reduced due to the poor blood flow or reduced blood flow or clogging in the arteries. You can see the plaque that can build up inside of there. You also want to look at the capillary fill time. That's kind of like where you hit the tip of the toe or push the tip of the toe and the redness goes away and blanches and then it comes back. That should come back in about 3 seconds. If that's not good, there may be a problem with blood flow. Also swelling. If you have swelling, you can develop skin changes. It can turn purple. You can get little sores in the legs and wounds, and that can be all a type of a problem. And the main thing you want to look at if you have diabetes is if you have cramping when you're walking, you may need circulation studies or blood flow studies. This is an example of a blood study that shows at the thigh level, right below the knee, and at the ankle level and foot level how the blood flow is. And you want to compare this to the level at the arm. Blood flow can be very commonly misdiagnosed with people with diabetes, and they can have clogging in the arteries that may need to be treated. The way I explain that is called peripheral arterial disease, but an easy way of explaining it is if you have a clogging in the arteries in your neck, it can cause a stroke. If you have clogging in the heart, it can cause a heart attack. If you can have it in your legs, it may cause this condition of peripheral arterial disease. Let's go on to look at the skin, different types of problems that can happen. Really, nails can become thickened. They need to be trimmed if there's a fungal infection. That's not specific to diabetes, but it can happen to a lot of people as they get older. People can develop corns and calluses. And the reason I kind of give a hard time about corns and calluses is that this callus on the bottom, so the main difference between a corn and a callus is that a callus is in the bottom of the foot and a corn is on the top or between the toes. And really what can happen is if this isn't treated well, it can develop into a sore or a wound. And because the increased pressure breaks down the skin and creates a wound underneath there. So that's very, very important to be aware of. That's why you should have these professionally trimmed. As well, be careful if you have any dampness between the toes. That can create some cracking. It can create some dampness and moisture in between there. And as well, athlete's foot may develop, and those are some skin conditions that can happen if you have diabetes. So you should really be aware of that and see a professional if you have any of those problems with the skin. Now, looking at the bone and pressure, if you have a area of high pressure, this could be caused by aquinas or a tight heel cord. Could also be caused by bunions or hammer toes. You can see here, these would all be high pressure areas in your shoe, and as well a condition called Charcot foot where your shoe may collapse and cause a bigger problem like that. Those are all areas, once again, you should be seen by a professional. It's real important if you have these conditions to get diabetic shoes. Diabetic shoes can help with that to reduce any of the high pressure areas. And then also looking at the feeling. The feeling is the fourth area that I recommend looking at. It's very important. You should have a Sims-Weinstein. This is a little piece of plastic that you push against the toe. If you can feel that, you probably have okay feeling. But if you can't feel it, it means if you step on something like a tack, you may not know about it. There's also a way to test the vibratory sensation. And usually the vibratory sensation goes first, and then you can lose the other type of sensation. Okay, so the gift of pain is really something that people lose with diabetes because the blood sugar affects the nerves, causing them to swell, and they don't transmit the pulses as well or the sensations as well. So it's real important for you if you have diabetes to get that checked out to make sure you don't have any neuropathy, or if you have neuropathy, to treat it. The best way of preventing neuropathy from happening is really controlling your blood sugar. So what are the recommendations? Look at your feet daily. I recommend tops, bottoms, between the toes. Get circulation studies if you need them, the blood flow studies, get diabetic shoes, and have someone do diabetic foot care or nail care, trimming the calluses for you. Here's some additional resources that I put on my site. One's a diabetes foot book. You can download with this link, a diabetes toolkit, and a link to the American Diabetes Association. Both of these can be found at my website, drpelto.com. If you put your email on the side, and I will email you the foot book and the toolkit. Actually, the foot book's in the toolkit, and then there's also links to these other helpful sites. Hope this helped.